Welcome to the webinar. We will begin in 1 minute. Good morning. Thank you for joining us and welcome to this 1-hour webinar on the standards of proficiency for registered nurses. My name is Sue West and I'm the Senior Nursing Education Advisor and leading on the implementation of the new standards. I'm joined today by Mary Tallant, our Education Standards Manager, and along with her is Chris Bell, our Standards Development Specialist, both of whom were part of the team developing the new standards throughout the consultation. And they will be reviewing and sharing your comments and questions as they come through. We also have Peter Hudson and Mohammed Parker, our communication officers, in the room, and they will be managing the IT. There are about 150 participants today in our webinar, which is really great. I'm really pleased to see such a large number. But as it is a large group, we will use mute and ask that you use the chat to type your comments and questions. So just see the orange button in the top right-hand corner, which says to all, and click on that. We welcome your participation by way of questions, clarification of understanding, and evidence of good practice, and we will be capturing this information so that it can feed into our supporting information that we're going to be developing around the proficiencies. This is in addition to the already published frequently asked questions on the proficiency page of our website and the information that's already available around the standards of student supervision and assessment. As we have such a large group, fielding all your questions and comments will be a challenge, so do bear with us. If we do not respond to your question or discuss the subject you raise, then please do send this through to our mailbox, which is education&standards@nmc-uk.org, and we will get back to you. We will also provide this email address again at the end of the presentation. So for the next 20 to 30 minutes, I'm going to provide you with an overview of the standards of proficiency and the things that you need to consider in order to implement the standards successfully. During which time, if you have any comments or questions, then please send those as instructed. I will also provide an example of practice learning across the 7 platforms and proficiencies with examples of how the standards of proficiency can be used as a tool for your own professional development. For students undertaking courses also on the pre-2018 standards, and also to plan the practice learning on the return to practice programs. These examples might clarify some of your questions, but do keep sending them in throughout the presentation. During the second half of the webinar, we will respond to some of your questions and share some of your comments. So without further ado, let's progress to the presentation. So nursing practice today is different from a decade ago, and we know it will change even more in the next 10 years. So nurses must be equipped with the skills and knowledge they deliver to deliver consistent quality care that keeps people safe now and in the future. We're mindful that there are more treatments, these are becoming more effective, and people are living longer, increasing the care needs of extreme old age and frailty and multiple pathologies. So therefore, care is becoming much more complex, and staff of nurses will require more knowledge and skills. And some of the interventions are more dangerous and therefore higher risk. So we need to consider that in the education of our future nurses. The issues that are raised within this are also about the problems that we need more people, we need the skills need to be higher, and of course to get both there's also issues around finances too, and we're mindful of these issues when we were developing the standards. So if we look at the next slide, which is the standards for education and training, this will just be a reminder that in the first box on your left-hand side, the standards framework for nursing and midwifery education is part 1, and part 2, the standards for student supervision and assessment. And these combined together are the standards that are impacting on all of our programs, not just Future Nurse. When you move to the middle box, the program standards, this is the library of standards, and in here we will contain the standards for Future Nurse for pre-qualifying nursing students. And in that library, we also have the program standards for other programs such as return to practice, prescribing programs, and more recently, once they're published, will be the midwifery standards also. But the bit we're focusing on today are the standards of proficiency for nursing and midwifery professions. In this instance, we're looking at Future Nurse, the standards of proficiency for registered nurses. So when we look at these, you can see in this box we have program standards part 3, which is in the bottom box, the grey box, but we're looking at the standards, Future Nurse, standards of proficiency for registered nurses in the teal box. So these are set, so the proficiencies are grouped under 7 platforms, followed by 2 annexes. And together these reflect what we expect a newly registered nurse to know and be capable of doing safely and proficiently at the start of their career. Key components of the roles, responsibilities and accountabilities of registered nurses are described under each of the 7 platforms. And we believe that this approach provides clarity to the public and the professions about the core knowledge and skills that they can expect every registered nurse to demonstrate. The outcome statements for each of the platforms have been designed to apply to all fields of nursing and all care settings. However, the registration to a specific field of nursing practice continues, and that's where we look at adult nursing, children's nursing, mental health nursing, and learning disabilities nursing. Precise skills and procedure annexes that apply to all fields of nurses indicate where greater field-specific emphasis and depth of knowledge and proficiency is required. Registered nurses must be able to meet the person-centred, holistic care needs of people they encounter in their practice, who may at any stage of life and who have a range of mental, physical, cognitive or behavioural health challenges. They must also be able to demonstrate a greater depth of knowledge and additional more advanced skills required to meet the specific care needs of people in their chosen field of nursing practice. When we move on to the platforms, and particularly in platform 1, being an accountable professional, 1.2 states, safely demonstrate evidence-based practice in all skills and procedures as stated in Annex A and B. And also need to account for greater depth of knowledge as indicated and can be demonstrated in theory, practice learning and simulation. So there are a number of changes, and as this slide demonstrates, the key changes down the right-hand side. So there's huge emphasis on person-centred care, and there's greater emphasis on relationship management and communication. And where this is important is it stands out in Annex B, and that's where you'll be able to see that detail. There's more emphasis now on public health, which has its own platform in Platform 2, and also on leadership. And the uncoupling of leadership and management is also indicated within Platform 5. The other emphasis here that we've got is around whole body system assessment, which includes chest auscultation, which is new and different to the current standards. And this is in preparation for nurses to be able to move more swiftly into prescribing by having that ability to systematically undertake an assessment in preparation for that. And that then aligns to the emphasis on pharmacokinetics and knowledge of prescribing practice. So at the point of registration, our newly qualified nurses will be able to move into the education of prescribing program, particularly the V100, and later, after a year of qualification, undertake the V300. But that is also in line with their scope of practice, support by their employer, and the fact that it is part of their job. Additionally, and this goes back to person-centered learning, is the emphasis and focus on mental, physical, cognitive and behavioural health. And you can't assess a person on one of these without assessing them on all, and so therefore is very relevant to the nature of these standards. And then looking further on, it's about preparing our future nurses to be able to support and supervise students at the point of registration. So there's emphasis on knowledge and ability to practice this throughout the programme. And finally, looking at these key changes here, about improvement methodologies, audit, health economics, and much more emphasis on political awareness. And you'll see that within the proficiencies, especially in platforms 5 and 7. So there are additional skills that are added in here, such as ECGs, IV therapy, venipuncture and cannulation, and mental health first aid, just to list a few. These proficiencies will provide new graduates into the profession with the knowledge and skills they need at the point of registration, which they will build upon as they gain experience in practice and fulfil their professional responsibility to continuously update their knowledge and skills. And for example, after these students register with us, registered nurses will already be equipped to progress, as I've said earlier, to that completion of the prescribing qualification. So, how do we prepare for these new standards? A lot of people think that perhaps this is just for our education providers to understand the new standards and plan their curriculum, but actually it's for all of us as registrants. We all have a responsibility here, particularly those of you who are preparing for the new standards and preparing those practice placements and learning opportunities. It's really important that you consider the full field experience. It's important for you to determine that you've got the right supervisors with the right knowledge and skills to meet the learning proficiencies, and also focusing in on the assessment of proficiencies and procedures, especially those where there's field emphasis and how students will understand that. And a lot of that dialogue will be had between the education provider and practice learning partners, particularly around how the practice assessment will take place and what models you will have in place. So those conversations are really important. But we have been working with partners across the health and social care sector, and the NMC supports and develops the workforce and enabling the recruitment and retention of nurses, midwives and nursing associates around development and the proficiencies. So our proficiencies for nurses, entitled Future Nurse, can be used as a guide for mapping and planning CPD for existing staff. So it's not just about the roles of practice supervisor and assessor, but using the standards of proficiency when preparing for your own revalidation in keeping with your scope of practice. And that way you may increase your knowledge and skills to be able to support the new students coming through in achieving the necessary knowledge and skills and becoming confident professionals. So also it's a useful tool for reflection and assessment to identify any gaps of further development. And I'll show you some examples as we move along shortly around how that might be. So this changing landscape, demographics and healthcare priorities means that the standards of proficiency for registered nurses needed to be ambitious to meet the needs of local populations now and in the future. And all registered nurses need to be aware of and understand the impact of change for their own role and how they can contribute to successful implementation. But we know that understanding across the workforce is variable, and it is not just about the changes in education roles from mentors to supervisors and assessors, it's also about how all nurses are making a step change to enhance their own practice. So the next slide is just giving you a header of learning in practice across the 7 platforms to achieve proficiency. And we're currently working on the best way to present to you scenarios of learning in practice across the 7 platforms to achieve proficiency. Although the responsibility of this lies with the education provider and their practice learning partners, the scenarios will provide simple examples to provoke your thinking about practice learning. So within this next section, I'm just going to share with you an example scenario. So let's just take a typical scenario within an acute hospital. So we're looking at Ward A. This is a surgical ward of 33 beds, and it's set out within bays of 6 patients. And Bay 1 has 3 nursing students, 1 RN, who's a supervisor, and a healthcare assistant allocated for the day. Under supervision, 3rd-year student nurse Darren is to lead, coordinate, and delegate the care of the patients to the other 2 students and the healthcare assistant. We'll also include the registered nurse in this too, and we'll be providing supervision to the 2nd-year student. So the key platforms that Darren potentially is focusing on here is Platform 5, which is leading and managing nursing care and working in teams, and Platform 7, which is around coordinating care. But Darren isn't going to be looking at all the proficiencies under those headings, and it will be for the supervisor to tease out which ones he will be demonstrating, but there will be some where, in fact, he won't actually meet. But he will need to plan quite clearly for how he will meet those going forward, and we'll have a look at that in a moment. So this slide, I know it's quite small in type, but wanted you to see it in its entirety, is capturing the learning of Darren across the 7 platforms. And it is not exhaustive, it just teases out some of the elements that are relevant to his stage of learning on this particular day with the patients he is caring for. And as I say, I'm mindful that the writing is small here, and it does show that the learning is holistic, just like patient care, and the end column will indicate how the skills that Darren can also learn and demonstrate are indicated. And in particular, if you look at Platform 4, providing and evaluating care, it does talk in here about patient B, who he was caring for, was having IV antibiotics. And therefore, in the annexes, in Annex B, the intravenous drug administration will be a skill that he will be learning on that day, being supervised by the registered nurse on duty. So that's quite important there. But also in Annex B, if you move to Platform 2, it's also about Darren being able to provide information in accessible ways to support his patients and understanding the care and treatment. So it's all about the communication elements that are coming out in Annex B. So that's just 2 examples, really, of how this all links together with both the proficiencies and the supporting skills and procedures. However, as I said earlier, Darren's not able to demonstrate all the proficiencies in Platform 5 and 7, and in partnership with his supervisor, Darren will indicate those areas that he wishes to learn more about, and whilst on placement, in order for him to demonstrate proficiency before he completes his programme of study. So, as an example here, we can look at 7.3 in Platform 7 around the implications of health economics and the resources for that particular environment. And 7.4 focuses on the understanding of health policy and the impact for nurses and other professionals. And so how, as a manager and leader on that ward, are they starting to focus on those health policies and the impact for them and the team? So, like I say, this is just a top-line example of how learning can take place in clinical practice. The next examples that I'm going to look at are around the proficiencies as a tool to develop the workforce through revalidation, and this is how it applies to current registrants, but also to nurses who are undertaking programs currently against the pre-2018 standards. So in developing the workforce, if we reflect back on the registered nurse who's a supervisor to Darren, and she's been able to supervise Darren in leading and coordinating care and also undertaking intravenous drug administration. However, one of her concerns was that she lacked skills in assessing mental health issues, such as high anxiety, as demonstrated by the behaviours to the confusion of one patient in their care. And therefore setting planned CPD around person-centred assessment of cognitive behavioural health, and therefore being able to reflect on this as part of her revalidation. And we've heard a lot from qualified nurses and current students that they are concerned that they will not be proficient or have the knowledge to teach some of these new skills expected of our future nurse students. And we would not expect any professional to teach something they're not proficient to do so. So it's part of our own responsibility in improving our own knowledge, as it says in the code, to be able to demonstrate this throughout our own professional development. So as we've said, the strengths and weaknesses have been highlighted here. But supervisors must have the knowledge and skills relevant to the learning outcomes of each student. And where there are skills gaps, we may want to use the expertise of other professionals who could supervise students. An example here is in general practice. So a GP could supervise a student to undertake whole body assessment. However, a general practice nurse may feel that the whole body assessment could improve the care she delivers or he delivers to the people they see. And this becomes a focus for their own CPD, and will be able to supervise students once they themselves are considered proficient. Most important of all is learning new knowledge and skills that can enable a qualified nurse to enhance their scope of practice to provide better, safer care. Such learning becomes part of continuing professional development and therefore forms part of the revalidation process. So if we look now at this example of a student who's undertaking a program once they're registered, in this instance, we've got a student who is able to supervise student within the scope of practice to determine through successful completion of the BSc nursing, and that's in relationship to mental health field. But they understand the theory of intravenous drug administration, but they lack the competence in carrying out the skill. And therefore, part of their work will be to action a planned supervised practice period in intravenous drug administration to confirm competence. And as I said earlier, we hear a lot about students who are being concerned that they are behind the curve than the students coming into play from this year and next year, and will not be able to supervise them effectively. But their programme of study provides them with the right and knowledge and skills for registration at this time, and these new proficiencies are preparing future students to the standards we expect of future nurses to meet population needs. Therefore, this example enables students also to use these proficiencies as a tool for their ongoing learning beyond registration. And it doesn't have to be such a physical skill of this, it could be much broader, but it will be just an example at this time. And finally, this particular example is looking at return to practice, and that's using the standards of proficiency again to determine where the skills gaps are. So some of you may know, and you will all know by the end of this, that we have approved and published a new set of standards for return to practice people. So where we want people returning to the register, they now have two options. One of those options is to undertake a return to practice programme, therefore they'll become a student, or from January of next year, they will be able to alternatively take a test of competence, just like those on our overseas nurses coming in now. And there will be more information on our website about that soon. But we're just concentrating on those that are undertaking a return to practice programme. And in this instance, it will be for the education provider to work with the student to determine what their skills gaps are against the new standards of proficiency and set out practice learning a period of time for them to gain that assessment. And this is just showing you that in this instance, we've got somebody who's been out of practice as a learning disability nurse, able to demonstrate knowledge and skills that they practice over a 10-year period in a residential home for people with profound and multiple learning disabilities. But they have some concerns here around the individualised care, but particularly around person-centred care and the prevention of ill health. And so the action here was to ensure that the planned supervised practice will focus on person-centred care. It will look at accounting for that physical, mental, cognitive and behavioural health issues of the individual, and will put emphasis on proficiencies within Platform 2. So it's where we're looking at preventing ill health of individuals with learning disabilities and promoting health and well-being for them too. And also it will take account of making reasonable adjustments whilst caring for people with learning disabilities that might not have been so clear in the previous experience of that particular nurse. So it's about teasing out the relevant areas of practice for that person's scope. So it's looking at those skills gaps. And this is just really one of several areas of learning, as I've said, and they're not exhaustive, these examples. They're just giving you some food for thought and to also make you think about how it might be implemented. So these examples, as I say, align to the circle of professional learning for practice in order to provide safer, better care. And that uses the standards of proficiency to enhance your scope of professional practice, linked to your CPD and revalidation. And this is clearly in keeping with the code. And this is what the code tells us all to do. So really important that you understand the proficiencies and the impact and what they mean for yourself. So ambitious new standards of proficiency here that will impact on us all. And this brings us to the end of the presentation, but I'm really hoping that you've sent in a number of questions and we'll be able to start to review some of those as we go forward. So thank you for listening to that. So Mary, what have we got coming through on our questions?
So I think first of all, I should say how many of you are attending our webinar today, and there's quite a lot of you. There's 209 online right now. So bear with me if you're writing in questions, there may be quite a few coming in at the same time. So I'll try and get to them and read and ask Sue the question as well. So the first question, if you can answer it, Sue, is what support is being provided to develop current nurses to become future nurses? And this individual is particularly interested in primary and community care.
Okay, so what we're looking at here is, and it goes back to the detail that we talked about with regards to for us as individuals taking on responsibility for our own learning. And a lot of people who are working in clinical practice have enhanced their practice over the years and may well look at proficiencies and say, I do that within my scope of practice. But it's about looking at enhancement. So if there is a deficit in learning, and forgive me if I've got this wrong, but if this individual wants to move within primary and community care, or if they're already in primary and community care, we can look at two different examples. So it's about opportunities, and we are looking more in the future of people to looking at transferable skills, identifying what skills you've already got and mapping it to be able to work into primary care, i.e. general nursing practice, in primary care, or looking at it in working in the community, either as a staff nurse or moving on to a district nursing programme, or even looking at it from a specialist community public health nursing programme. So you can look at it in different ways about how and where. But your emphasis, I believe, was on support. This is about your appraisal, talking to your manager, determining where you want to go, looking at opportunities for development, looking at shadowing people in the community or those in some of these key roles. And this can be all part and parcel of your continuing professional development.
And on professional development, we touched on revalidation, and maybe we can clarify to our audience the requirements that they have with regards to these new standards. Will they be required to meet all these new proficiencies?
The first answer is no, you won't be expected in your revalidation to deem proficiency in all of these standards. These standards of proficiency are set for our newly qualified nurses to be able to demonstrate at the point of registration, and that is quite key. When they move into their scope of professional practice, and some of the skills that they may have, they may not use over a period of time. It really depends on where they are working. And if they do come across a skill that they not practiced for some time, we apply the code, and we know that we need to perhaps do further supervised practice to do that skill again to make sure that we are proficient and competent in that area of learning. And that's quite key to all of us. So it really depends on your scope of professional practice and whether or not any of the proficiencies will enhance care. And if they will, that's about you determining your skills gap, identifying where your CPD should be lying in order for you to provide better, safer care going forward.
I think this leads nicely also into the role of the supervisor. So in our past framework, supervisors were only registered nurses in that field of practice. So maybe you can touch, there's a few questions here about who the supervisors can be, and if the registered nurse doesn't feel proficient or doesn't feel that certain skills are within their own scope, how could a student learn?
Okay, so if a supervisor, that obviously they've got the skills, knowledge and ability to care for patients within their scope of professional practice. So all of that they should be able to support and supervise a student to undertake, because that is what they're capable of doing. Now, if there was a new skill that a student says, and let's take, for example, chest auscultation, they may come along and say to their supervisor that, this is one of the skills that I need to undertake. How can you teach me to do that? And that then puts the supervisor in the position of, well, you haven't got that skill. And that's not a problem, because what you're doing here is determining the best person who can act as supervisor within that scope of professional practice where that student is undertaking practice learning. And it may be the physiotherapist is the best person to teach that specific skill. But it doesn't mean to say that the registered nurse, if they were working in a respiratory environment, either in an acute care hospital or in practice, by being able to undertake chest auscultation themselves, then care to the people they're caring for may well be improved. So it might be that that is an area they want to go and do CPD on in the future, whether that is by shadowing somebody, being deemed proficient by a physiotherapist or a general practitioner. It can vary as you go forward, or they might want to undertake a formal route of study. So really it is about the fact that supervisors can be any health and social care professional, and they have to have the right knowledge and skills within the scope of practice to which the student is now undertaking practice learning. And so it can be a registered nurse, it could be another professional, such as I identified as a physiotherapist, or it could be one of the doctors in the ward or a general practitioner. It can be anybody out of nursing as well. When it comes to assessment, quite clearly that will have to be a registered nurse on part 1 of the register. But certainly when it's looking at the skills development of individuals, then it's about the person has to have the right knowledge and skills in that particular area.
And so there's a few questions here about how the supervisors and indeed the assessors, how will they be prepared and whose responsibility is it?
So for some of you, I know that this has been a big change, moving from mentorship, where we have been very process driven in saying that mentors have to undertake a mentorship program, which we approve, and likewise for practice educators, etc., doing teaching qualifications, and those in academia doing a teacher qualification. That is now going to stop, so we will no longer be approving those programs of study to enable people to support, but we do expect all of our supervisors and assessors to be appropriately prepared to be a supervisor or assessor. And if you go to our supporting information on the website, it does share on there the information that people require in order to carry out these 2 roles. So it tells you about the roles and what the expectations are. But the responsibility here lies with the education providers and practice learning partners, who together will determine what that preparation will look like and who will provide that preparation. Now, quite clearly, our mentors and sign-off mentors that are currently in place will have lots of transitional skills that they can utilise to be able to be part of that role, but they will still need some preparation to understand the new standards in order to put them into practice. And that will be, like I say, will be determined by the education providers and their practice learning partners.
Okay, next one that's come through. What does safely demonstrate mean, and where local policies have not yet been updated, is demonstration in simulation acceptable, or do all skills have to be completed in clinical practice?
Okay, so safely demonstrate, and most of you will be doing that anyway now with students, about making sure that students are able to safely demonstrate a particular skill or safely demonstrate knowledge and understanding, even if their written work has to be done in a safe way too. So we're accounting for things such as confidentiality. So within this instance, it will be part of the practice assessment documents. Again, this will be determined by the education provider and their practice learning partners. But I'm just going to go back to Chris just to clarify. You also talked about the skills, what could be done in practice and what could be done in simulation. Now, what we say here is that all practice related knowledge and skills should be demonstrated on and with people, because that aligns to the EU regulations. And it doesn't mean to say that people cannot learn any of their skills as part of simulated learning, as long as that simulated learning is done on a real people. It can take over some of the practice hours, but any student nurse can undertake simulation in a safe environment. We recommend that as much and practice as much as possible, even if it's on mannequins, or even if it's with their own student groups in doing a certain amount of role play. But that really is about practicing and not necessarily practice learning hours in that instance. But I think the other part is around assessment here. And what we say is that where possible, all the skills should be demonstrated in practice learning on and with people. However, we do know that there are instances where this isn't possible, or a student hasn't necessarily had the opportunity to practice a skill, and therefore assessment may take place through simulation. What is key here, and is written within our standards, is that simulation needs to be used proportionately, and therefore, if it's used proportionately, that will be demonstrated through the curriculum development, through the assessment process, and will go through that approval process that all programs go to before students undertake those programs. So it's about demonstrating that proportionality of the use of simulation, how it is used, how it meets the EU regulations within the curriculum in order for that program to become approved.
Thank you, Sue. There's a few questions here about fields and the Annex B procedures, and how would a student learn and be assessed if they aren't exposed to certain Annex B procedures. And I suppose an example of this is IV administration in a mental health setting.
Okay. So this is actually quite a common question that's being asked, and as I've already stated, is that all of these will need to be demonstrated to be achieved. So somebody who is who's a student who's undertaking, or their scope of practice is going to be the field of mental health, will have to be able to demonstrate that understanding of giving IV administration of drugs throughout their program. And therefore this is more about looking at practice learning opportunities, and if, for example, the area of practice that the student is within a mental health field might not at the moment be able to do or commonly do intravenous drugs, it may be something that will enhance the care of people, particularly the physical care of individuals in mental health environments in the future. And so we want all of our students, despite the field, to be able to undertake some of these skills. And this is a common example, is the use of intravenous drug administration. So it is about how the actual placement learning is planned to enable them to get that experience. But as I've already said, there is this element of, in exceptional circumstances, it may be that they're only able to demonstrate that proficiency within simulation.
So Sue, there's quite a few questions about assessment and what has happened to the sign-off mentor and who is assessing, and how can we ensure consistency across assessments as well? Okay,
so this is really looking at education providers again and their practice learning partners and how they are preparing individuals to assess the students going forward. So the how this happens is up to that partnership working within the curriculum. It's how the actual practice assessment document is written, and the expectations and the guidelines that support that practice assessment needs to take place. So for me, it is about having the conversations with the education providers in order to make sure that that consistency does exist. And we've got to remember here that actually this is all about evidence-based best practice approaches, and that is around where you're providing best practice. If you understand what best practice is for a particular knowledge or skill or the way somebody should perform, then it is that expectation that becomes your measure.
And the assessors need to be registered nurses in the field that the student is in, or just experienced in the field? That's their scope of practice. Can you explain who can assess, say, a mental health nurse student?
So what we already know is that currently the fields exist, but it's part one of the register. So the expectation of the standards is that it is the nurse who can assess is somebody who is on the same part as the nurse that they are assessing will be on. However, they've got to have the right knowledge and skills within that scope of professional practice. So if you have somebody who's on part one of the register who originally trained and registered as an adult nurse, but throughout their career has moved, progressed, developed new knowledge, and now is actually working in the field of mental health, and you've got a nurse who's on the field of mental health, a student nurse, then as long as they've got the right knowledge and skills to be able to supervise that individual within that particular field, then they can do so. So it's real emphasis here on having the right knowledge and skills, and if they're working in that environment, then surely they should have, and they should have also maybe undergone a certain amount of study and preparation, but they are deemed as competent practitioners in that field, then they can support that, they can assess that individual. So the field isn't key, it's really around that knowledge and skills within that scope of practice.
There's a few queries about the supervisor, and just to clarify, the supervisor does need to be a registered health and social care professional, but we do acknowledge that students can gain really good learning opportunities in practice settings where there may not be a registered health and social care supervisor, and in that case we'd be looking for adequate oversight, and there's means and methods in which you can provide that through maybe long arm supervision or hub and spoke models, but we still want to see oversight from a registered health and social care professional who'd be acting in the role as a supervisor.
Yeah, that's absolutely right, Mary, and it is really important that that oversight is put in place, particularly when individuals are starting to achieve those proficiencies. And some examples of that have come out of schools where student nurses are being placed in schools, especially where they're looking at learning disabilities, in learning disability schools. There's a lot to be learned there. There's a lot for our children's field to learn also around development of children and behaviours of children, and sometimes a teacher is in a really good position to be able to share their knowledge and skills around that, but there has to be oversight. So whatever the learning outcomes are that are set, there's got to be coordination of that learning by a supervisor.
Somebody has commented that Health Education England have written a 3-day preparation guidance for a practice supervisor and practice assessor. So although we have not had sight of that, there's lots of different resources that are starting to be developed outside of the NMC that are really useful and practical. And Sue, maybe you have something to say about that.
Yes, you're absolutely right. There's a huge amount of work that has gone on over the last 18 months, and each of the 4 countries, so that's England, Northern Ireland, Scotland and Wales, each of those has a board. So in the devolved countries, the Future Nurse, Future Midwife Implementation Board sit, and in Wales it's called the All Wales Group, and in England it's the Future Nurse Oversight Board, and each of those boards have been really looking at how individuals can be supported to be upskilled in both the supervisor assessor role but also in new skills. They're also looking at the models of supervision and assessment, and also developing a practice assessment document too for students. So there's a lot more coordination going on across the countries. Each of the leads of those boards speak to each other. And what you'll find is that in each of the devolved countries, they've got some good resources starting to develop that you can look at. And it doesn't matter, you can look at those because it repeats and it aligns to our standards. We've also got the development of practice assessment documents. Certainly looking at those that have developed in the Midlands, they've got the sort of Midlands, the MyPad group, it's called, or the My group. So that's the Midlands, Yorkshire and East have got their group. They've got a website, they've got lots of resources. The same with the Pan London group, lots of resources are being developed. Capital Nurse, more resources. The Royal College of Nursing have got their practice learning part of the website, and they're really adding to those resources now. There's some videos on there too. So yes, you will start to see lots of different resources coming around the country that you can draw upon to help you with your thinking.
So you've touched on something there, Sue, is that there has been a comment about consistency and preparation, but what you're saying is that a lot of the devolved nations, the 4 countries, are actually coming together and working to form a consistent approach for their nation, and it will only evolve as time goes on, so that training and preparation for our supervisors and our assessors will start looking. Well, we have our standards that are outcome focused, so we know what we expect in terms of QA, when we QA, and what we look at and what we want. But the actual preparation will start to align in certain areas. And
yes, and actually the needs are quite different in each of these areas, and that's really important. So where we're looking at, I have heard that there are different preparation programs across different environments, and that might be relevant for those particular areas, but it is around making sure, as Mary's just said, all of our standards are outcome focused, and therefore as long as those processes and the way that people are prepared and meeting our standards, then that's satisfactory. So it might be that they're delivered slightly differently. So practice partners may prefer to deliver that preparation, the education providers, or they might do it in partnership, and then looking at the timing and the content has to align with the standards. So although it might be seen that there is some inconsistencies, the end point is the outcomes have to be met, and that's what determines that consistency.
Yeah, and we need to let you know that we quality assess and assure all of our programs to ensure that our outcomes are met, and that's how we are assured that safe and effective learning and practice is happening, and that the supervisors and the practice assessors are carrying out their role appropriately.
And that's just like we have been doing to date with mentorship. It's just that we've had certain processes in place to date that I know many of you have found act almost as barriers to be able to create good learning environments. And so by taking away those barriers, making our standards outcome focused, we will be in a much better position to enable that innovative practice learning to take place.
There's a few questions, and I think it's just a change of language, but maybe a change of definition as well. What is the difference between competency and proficiency?
So when you're actually looking at this terminology, if you're being able to demonstrate competency in doing something, so you can actually demonstrate a skill of how you're doing it. But when we're talking about being proficient, this is about, at the time you actually determine competency, it's looking at a here and now scenario, whereas when you're demonstrating proficiency, you're actually putting in that much more holistic view in being able to determine that you've got that broader understanding, knowledge of individuals, the care that they're requiring, the skills that you're carrying out, and actually working in a much more proficient way. And so it is looking about the way people practice rather than actually focusing in on a competent thing that an individual has done. So that's really why we're talking about them in this way, because you can use the term a student was competent in, but actually they are demonstrating proficiency on an ongoing way.
There's a question here about simulation and whether that can be used in the academic setting as a means of assessment of a proficiency.
So simulation. So this goes back to what I said earlier, really, is that you can use simulation practice within the academic environment, particularly where there are some really good skills laboratories where people can work. Some people can even manage a ward in some of the skills laboratories, but actually be able to demonstrate some of the proficiencies as part of that practice environment. And yes, that can be done in that environment, and you're probably also demonstrating proficiency, such as basic life support is often demonstrated as somebody being proficient in carrying out that skill, whilst they are in the academic environment within a skills laboratory, and that can happen. But it goes back to what I said earlier, was what we would expect is for students to have practice learning experiences that enable them to achieve all the proficiencies and the skills in Annex A and the procedures in Annex B with and on people in practice learning. But we know that there are sometimes instances, so in exceptional circumstances, they will be deemed as being proficient through simulation. So it's about how that is, making sure that there is this balance between the actual practice learning and simulation.
Simulation does seem to be a very popular topic at the moment. We've got two more coming in on that. One here about with talking about simulation and saying, does there have to be a need when you're having to demonstrate proficiency in something through simulation? And there's the words is used on and with people. And the question is, do these people need to be service users or carers, or can they be actors or some other form of?
Okay, so again, it really goes back to meeting the EU regulation, which is stipulated within our documentation, and I think it's really important that that is understood, and that the actual EU regulation is really focused in on the actual working on and with people. But it may well be that you can set up some good simulation and learning with actors, such as we've done before in using OSCEs, for example, to be able to determine that. The bit that becomes difficult with the EU regulation is whether or not that can replace practice learning. And so, it is about looking at the community and the practice learning environment that is more important when we're looking at practice hours. But if you're actually doing lots of practice on and with people in simulation, then it is how you define that with regards to the EU regulation.
Okay, and another one that's come up here, going back to supervision, I think this is one we've had inquiries on in the past as well. Are we anticipating that there would be like a one student, one practice supervisor model, or is there an expectation that students will work with a wider range of practice supervisors, so they may be just reporting into one assessor?
Well, that again is entirely up to the education provider and their practice learning partners as to how that might work, and any of the above could happen. We are expecting, these are different standards and there's different ways of working, and they are encouraging innovation with regards to the type of model that's put in place. So we're not saying how that should work. That is really down to the education providers and their practice learning partners.
But what we'd like to see is that it's student-centered, so it would be dependent on the student. So if the student requires to develop a number of proficiencies, and in order to do so they would need a number of supervisors, then they may have a schedule in which they work with a number of supervisors within their day or even their week or month at that practice setting. You also might find that as the student develops throughout the program, there may be more of an opportunity to allow the student to work more independently with more of a long arm supervision. So it wouldn't require the same intensity, let's say, of supervision as the student becomes more proficient and independent. So it really is when it comes to organising supervision, there's a number of factors that need to be considered, and one of them is also looking at the students and what they need.
Yeah, and I think that's quite key, Mary, thank you, because one of the areas here is around that student empowerment, and as the student demonstrates proficiency over time, it is for the supervisor to start to be able to supervise more at a distance, and that is really, really important.
So just one more, and it's about how these standards, we want the practice placement partners and the AIs to be working more in partnership together, and that includes coming together and organising the assessment and the modes of assessment, and that also includes the practice assessor and the academic assessor working together to decide on whether the student will move into the next part of the programme. And that's really important, but that's for you to form those relationships and to develop how to do that. And I'm afraid I think that's all we have time for right now, but Sue, over to you.
So I just want to say a huge thank you. We've had some really interesting questions coming through. Some of them we have been hearing as we have been presenting and talking to people about the standards. So thank you for putting those in. I really hope that you've engaged and enjoyed the webinar and taking something away and having conversations with all your colleagues too, because it is about spreading the word. So what I will say is now the education standards is on that slide. So the actual the email address, and we will also make these slides available to you in the future. We'll just check to see where that link will go, but probably on the Proficiency page. And if there is anything that's coming through from your questions, we'll look about how we can provide that within the supporting information going forward. So once again, thank you from me and the team, and see you all again soon.
Thank you.
Thank you.
Thanks very much.